Hello, my name is Brandon Lee, and the question I asked myself for this project is how do pharmacy information systems impact pharmacies, and what are the different consequences associated with the transition to digital? What got me interested in this subject is that because I am on the path of becoming a pharmacist, I think knowing the different troubles associated with these systems currently will allow me to voice my opinion to whatever company I wish to join to change them. First of all, what do health information systems do? These systems are software programs that collect, store, and analyze patient and related administrative information. What are the goals of these systems? They allow healthcare organizations to increase efficiency, reduce medical errors, and increase cost savings. The most basic functions that pharmacists utilize are assisting them in storing data regarding prescriptions and distributing medications. Because of the benefits, the government has offered pharmacies financial incentives to adopt these systems. So now I am going to discuss the impact of these systems. Compared to written records, these systems have given pharmacies the tools they need to maintain and analyze patient information more efficiently. There are many programs and software that have benefited the pharmacy industry, such as pharmacy information systems, computerized provider order entry, e-prescribing, and clinical decision support tools. First of all, what is classified as a pharmacy information system? There are many basic functions, such as order entry, medication dispensing, and inventory management. As you can see, a major part of a pharmacist's job is inputting the medications into the patient's medication profile. This way, the system will have the information for other people to use. System vendors have designed the interfaces to assist pharmacists in terms of workflow and reducing chances of error, such as ensuring legibility. In addition to that, medication dispensing and inventory management can be done automatically by the pharmacy information systems. Medication dispensing is done with barcode medication administration, where nurses would scan the barcodes that pharmacists put on the medications to ensure that they have the right patient, right medication, and the right time of dose. With electronic inventory systems, pharmacists are able to tell how much medication they have in stock and whether or not they would need to order more inventory. These help reduce medication errors and increase efficiency. Pharmacists also utilize these systems for medication therapy management. They look at the electronic medication list to identify drug interactions in order to prevent harm to the patient. The goals of these are preventing medication-related problems, improving patient outcomes, and increasing cost savings for patients. More software vendors are incorporating clinical decision support tools into their pharmacy information systems to improve patient safety. What do clinical decision support tools do? Clinical decision support tools assist pharmacists by presenting relevant information while verifying patient medication information. More advanced systems can provide good recommendations of what course of action the pharmacist can take regarding a patient's drug therapy. This helps pharmacists prevent errors and improve the patient's quality of care. According to one study, researchers analyzed 5 different studies and they supported the clinical decision support tools have on medication safety. How widespread is this type of system? According to one study, researchers interviewed 475 members of a hospital, and all of them responded that their pharmacy systems provided drug interaction alerts. Computerized provider order entry and e-prescribing have allowed physicians to prescribe medication orders electronically using secure networks. The goals of these are increasing the quality of patient care, such by reducing errors and increasing communication between healthcare professionals. According to a study done with 152 pharmacists, there's a significant positive relationship between the ease of use and e-prescribing's impacts on pharmacists' medical interventions, such as aiding pharmacists with error prevention. Also, they help reduce costs and increase efficiency. In regards to increasing efficiency and reducing costs, e-prescribing reduces the number of phone calls between pharmacists and physicians and increases the speed of refill requests. E-prescribing has become more widespread over the years. According to one study, in 2010, over 320 million prescriptions were transmitted to pharmacies nationwide, and you can compare this to the previous year, where only 191 million prescriptions were received electronically. Now I am going to be discussing the problems with health information systems. There are three main challenges that pharmacy information systems can overcome to become better. The first challenge is the resistance from employees. Because they are either not used to the systems, they may dislike the initial switch or feel like it makes the workflow much more inefficient in the beginning. According to one study, pharmacists who interviewed wanted to keep the current system, even though the current system is not the most optimal process. Even if there is no resistance, pharmacies still need to invest money into staff training and maintain software support. Also, there is a lack of standardization. First of all, these systems still have reliability and usability problems. Because of how important it is to maintain these systems to help patients, standardization and regulations are vital. Also, the terminology within pharmacy informations, excluding pharmacy medication terminology and pharmacy technology, are not standardized. The variability in definitions makes it truly difficult to document and bill services correctly. This also relates to the problems that medication therapy management has, which also suffers from documentation and billing problems. Along with this comes the problem of inoperability. The lack of inoperability causes pharmacists to receive incomplete medication lists or to become confused about the location of specific data. What's causing this lack of standardization? The main reason is the system vendors, because they make systems based on laws, requirements from accrediting bodies, and the pharmacy industry. There are many possibilities of designing the system to fit the qualifications. Pharmacists experience alert fatigue on these clinical decision support tool systems. Although alerts try to help, after dealing with less important alerts, pharmacists become desensitized by the alerts in general. Also, pharmacists now rely on these systems for verification, overlooking common mistakes. E-prescribing improves efficiency and cost-effectiveness in some aspects, yet decreases them in others. First, let's talk about human error. The most common errors with e-prescriptions have been physicians prescribing the wrong drug or putting the wrong directions. So, in one of these studies, it was shown that retail pharmacists spent an average of 6 minutes to resolve these orders, and this translates to $4.74. Other errors include technical and design issues. These include a low visibility of drug names and instructions, mistakes in names and drug qualities, and more. These happen more often because of the use of the auto-population feature of e-prescribing systems. It was illustrated in one study that 44.3% of errors happen with e-prescribing, and this would not happen with handwritten prescriptions. The third challenge is organizational issues. In order to utilize the full capabilities of the system and to reduce the number of technical mistakes made, it is important for pharmacy organizations to train their pharmacists to achieve optimal use. 54 pharmacists that were interviewed in one study kept bringing up how there's a need for more education on these systems. However, this has become difficult due to the costs involved with training. Another issue that sprouted up is the percentage of patients using multiple pharmacies increased after the implementation of e-prescribing. These types of mistakes increase the chances of patients being harmed by being administered incorrect drug therapy. So now I am going to be talking about solutions and recommendations for dealing with these problems. In terms of how this industry can overcome these obstacles, there are different approaches to this. The first is with government intervention. If the government provides financial incentives, this could increase adoption of these systems within pharmacies. Why would the government want to do this? This brings up to point 2, further research. More research should be done on the impact of these systems. If there's more evidence backing up the improved quality and patient safety, such as by developing more measures to assess the impacts, the government is more inclined to help increase adoption. The third recommendation I can give pharmacies is to provide staff more training on these systems. Further research should be done showing that the costs of training would be offset by the benefits of implementing the system. The final recommendation would be to have pharmacists assist with system design. There's a lack of interoperability due to a decentralized regulation and standards. Pharmacists should help aid system designers with this process because they could create programs that are more intuitive to use based on pharmacist behavior. If more systems become similar to use with this change, this would allow pharmacists to be much more familiar with working with the technology, effectively reducing human error. Pharmacists could allow using this approach to make documenting and billing for medication therapy management more consistent. Now I am going to discuss solutions to the problems of clinical decision support tools. To fix this, fatigue pharmacy organizations can be more selective with the types of alerts that could be displayed. There are many different tiers of alerts, so organizations should just display the most important alerts to pharmacists. In addition, pharmacy organizations should figure out the different reasons why pharmacists override alerts. Pharmacy organizations should educate the system vendors on what types of overrides pharmacists do on a regular basis and what exceptions to put into the systems. Now I want to talk about the research limitations. There's a lack of research in this field. There should be more research with more objective data supporting how much efficiency and cost savings these systems would provide once implemented within a pharmacy. Also, the study's research did not have large sample sizes, meaning the samples were a little skewed. There were 15 studies looked at, which helped mitigate some errors, but not others. Finally, I would like to end with what these systems helped improve in the pharmacy. They have increased efficiency, reduced costs, and improved quality of care. The challenges that these systems need to overcome now are organizational, technology design and capability, and interoperability challenges.